まあね、僕もう今年50ですけれども、ゲームとともに育ってきた感じがある世代なものですから、単純に、自分がセガのゲームになるってその嬉しさねこれはなんでしょう、僕ぐらいの、世代のゲーマーの連中はみんな憧れのものだと思いますからね。まず主人公の、周りに、いるなんですか、ライバルというか負の相棒というか、そういう感じのキャラクターですけれども、ちょっとね物語のキーとなる人なので、どうゲーム内で活躍するのか楽しみですけども、そこもよく分かってないんだよね、正直
はい、そうですね、ピエール瀧さんは、スナックラジオという、ピエール瀧のスナックラジオという、ラジオ番組でご一緒させていただいてるんですが、もちろん今回の写真集で撮っていただくことも初めてで、どんな風に撮っていただけるのかと、ワクワクしていました。で、撮影にいざ最初に撮っていただく時は、リリーさん自身がこう気に入ったなんていうの、その納得した時にしかシャッターを押されないんですね。で、そこがすごくその今まで撮っていただいたカメラマンさんとちょっと違うなと思ったところで、それで私もこうかなっていう風に一緒になんか作品作りをしているような気持ちになって、とても楽しかった印象です。
まず僕は九州の福岡県生まれで、アマチュアバンドがあって、で ARB っていうバンドが東京でできるっていうことで、オーディションでボーカルのオーディションで決まりました。でデビューが1979年、それから1980年代全般ですけど、非常に行き詰まりました。バンドがもうバンドはここまででやめようかなっていう問題を抱えてました。その時に、松田優作さん
映画館に入って暗闇になると全く別の世界に連れて行ってもらえるっていう、日常の非常に厳しい生活のことも一瞬忘れて、その映画の世界で何か日常生活に生き抜くための勇気を与えてくれるものは映画だと思うんですよね。戦争中だって映画館をやってたじゃないですか。この新型コロナっていうのは本当に、エンターテインメントの業界には本当に恐怖だと思いますね。でもその中でやっぱり勇気を与えてくれるもの、希望を与えてくれるものってのはやっぱり大事なものですから、それは映画っていうのはその一つだと思っています。でも全くその他人同士で見てるんですけども、誰も邪魔する人もいないし、あれなんですけど、でも同じものを共有して見た仲間はいるんですよね。特にどうだったっていう聞きはしないですけど、でもなんかこんないい映画を見たときには、こんないい映画を一緒に見た人と劇場出ていくときには、ちょっと家で映画を見るのとは違う感覚もありますね。映画館でやるために、その監督もスタッフも作ってますからね。やっぱりテレビで放送されるものってのはやっぱり音量的にもいろんな制約がありますから。ただ完璧な状態で見るのはやっぱり映画を見るのには映画館。すごい力があると思います。
Cedars-Sinai is one of the largest deliverers of healthcare on the West Coast. We run a large primary care network, and at the same time, we also deliver the most complex, complicated quaternary and tertiary services, programs that really require the highest medical skill and talents in the nation.
Cedars-Sinai has gone through a tremendous transformation. We went from a high-quality, community-based hospital to an academic powerhouse.
One of the great advantages we have, of course, is living in one of the most wonderful and diverse cities in the country, and it doesn't hurt that the climate isn't too bad either. We are blessed by a great environment, intellectually as well as personally. We get nearly 200 applicants for every one of our residency slots. And that allows us to have the very brightest trainees who make our chances for continuing to push things forward and innovate even greater.
General surgery really pulled me in because it kind of lets you fix any problem they're going to throw at you.
You go into residency with kind of this one track of, okay, I want to be a good surgeon, but then you come out and realize what it actually means to be a good surgeon. There's so many other parts to it. You know, the mentorship part of it, there's the support part of it, there's the personal skills and emotional intelligence side of it.
I think we're unique as a program in a sense that we have designed our curriculum that interns are operating as soon as they hit the hospital on their first day of internship, that they are already in the operating room learning the basics of surgery already.
You're given autonomy to make clinical decisions of do we go to the OR or not, but if you aren't sure, you feel very comfortable turning to one of your attendings and say, listen, I don't know in this case, and I'm looking for guidance for this. And they're very happy to sit down and, reason things through.
We are one of 6 sites in the United States that are referred to as a catalyst program for robotic surgery, where our surgeons actually teach other surgeons and robotic surgery and how to establish robotic programs at their institutions. And we want to train residents that will be technically proficient in all types of surgery.
Our residents have an extraordinary track record at being awarded fellowships and research slots around the country when they complete, and more than 70% of our residents in general surgery go into academic medicine.
The variety in the patient population here at Cedars has been a very great learning experience. You really are able to learn how to diversify your interactions with patients and how to really become more culturally aware and deal with some difficult patients, both socially difficult or emotionally difficult, and I think that's really important in training.
There is some real friendship and camaraderie amongst the attendings and the residents, and that's, I think, the most important part of wellness here.
And I think that's unique about Cedars and the culture that we have here, where the senior faculty and even junior faculty are very comfortable with their relationships with residents and want to foster this environment of collegiality and camaraderie.
There's no other place and no other people I'd want to go through this experience with than the people that I've met here and the relationships I've made and the family I've developed here.
In health news this morning, a look at the latest numbers reveals that chronic kidney disease is increasing.
Diabetes and high blood pressure are the most common causes for this. Sunrise reporter Roland Rodriguez is joining us live this morning from Bay Area Hospital with more on that. Roland, good morning.
Hey, good morning, guys, and good morning, South Texas. More than 30 million adults have chronic kidney disease. Is now joining us early this morning is Dr. Amber Callis. How are you doing, doctor?
I'm doing great, thank you. And good morning, everybody, and thank you for having me this morning.
Oh, it's a pleasure to have you join us. Let's talk about this disease. It seems like out of the 30 million people, it seems like a lot of those numbers come from right here in South Texas.
That is correct. Unfortunately, this is a major health problem, and the number of chronic kidney disease patients is increasing. We have risk factors associated with the chronic kidney disease, mainly diabetes, high blood pressure, and family history of kidney disease. There are other diseases can cause kidney problems like certain medications and autoimmune diseases. And unfortunately, all of those diseases are increasing in number, and the prevalence in South Texas is increasing.
How do we fight that?
Well, we need to raise awareness about the chronic kidney disease. Early detection of the disease can prevent the progression of kidney disease and prevent it from going so advanced to the point of kidney failure needing dialysis. So mainly we need to educate the patients. If you have any risk factors that can cause chronic kidney disease like diabetes or high blood pressure or family history of chronic kidney disease, you need to ask your doctor what is my kidney function? Do I have protein in the urine? Do I need to see a kidney specialist? What can I do to prevent this? So what I advise all the patients to do is mainly to make sure the diabetes is controlled. We need to make sure the hemoglobin A1C goal is less than 7. The blood pressure needs to be controlled. Healthy diet is very important.
Yeah. What are some of the signs that we should really look for? Now, you know, the early signs especially.
Well, unfortunately, chronic kidney disease is a silent disease. If we experience any symptoms, that means we waited too long. That means the kidneys are shut down and the body is giving up. The signs of the kidney disease, which once again we should avoid waiting until this happens, it includes nausea, vomiting, loss of appetite, fatigue, lack of concentration, sleep disturbances, sometimes cramps. Once again, we should not wait for those symptoms to happen. So we need to follow up on the kidney function and make sure we're not taking any medications that can, like non-steroidal anti-inflammatory medications. I want to stress this point. A lot of patients don't know that medications like ibuprofen, Advil, and Aleve can actually damage the kidneys to the point of severe kidney failure.
Yeah. Dr. Collis, thank you so much for the insight. Really appreciate it. Of course, you would like more information on the chronic kidney disease, visit our website at KRISTV.com. Reporting live from Bay Area Hospital, Roland Rodriguez, Chris, 6 News.